34 million people. That's the number of Americans living with diabetes. And this figure continues to rise. But here's the real concern. Most of them don't realize they're deficient in 3 crucial minerals that can significantly improve blood sugar control. If you've tried cutting carbs, taking medications, exercising, but still experience erratic blood sugar levels, your body might be crying out due to a nutritional deficiency. Today, we'll uncover the 3 essential minerals that every diabetic must not overlook. They don't just stabilize insulin, but also protect the nerves, boost energy, and reduce the risk of complications. Don't miss out because, at the end of this video, I'll share the best food sources for these minerals and the most effective ways to maximize absorption. If you want better blood sugar control, hit like, share this video, and comment below on which mineral interests you the most. 1. Magnesium, the blood sugar stabilizer that most diabetics lack. Did you know that nearly 48% of people with type 2 diabetes are magnesium deficient without even realizing it? Source: National Institutes of Health. This is not a small number, and its consequences can be more severe than you might think. A magnesium deficiency not only makes blood sugar harder to control but also increases the risk of complications such as cardiovascular disease, nerve damage, and kidney issues. Why is magnesium so important? And how can you supplement it correctly for optimal results? Let's find out now. Magnesium and its crucial role in blood sugar control. Magnesium is an essential mineral that helps regulate over 300 enzymatic reactions in the body, including many functions directly related to blood sugar control and insulin sensitivity. Improves insulin efficiency. Magnesium plays a central role in activating insulin receptors, allowing glucose to move into cells for energy rather than remaining in the bloodstream. Reduces insulin resistance. Research from Diabetes Care has shown that magnesium supplementation can significantly lower fasting blood sugar and HbA1c levels in people with type 2 diabetes. Helps prevent complications. Magnesium supports stable blood pressure, prevents arterial stiffness, and reduces inflammation, thereby lowering the risk of heart attack, stroke, and kidney disease. The problem is that high blood sugar forces the kidneys to work harder to eliminate excess glucose. But in the process, a significant amount of magnesium is also lost. This explains why diabetics are more prone to magnesium deficiency than others. Warning signs that your body is deficient in magnesium. A lack of magnesium can lead to various uncomfortable symptoms that you may have experienced without realizing the cause. Here are some common warning signs. Muscle cramps, spasms, or eye twitching. Magnesium helps relax muscles, and a deficiency can cause stiffness or cramping. Persistent fatigue. Even with adequate sleep, magnesium is a key component in ATP production, the body's main energy source. Anxiety, stress, and insomnia. Magnesium helps regulate the nervous system, reducing stress and improving sleep quality. Irregular heartbeat or heart palpitations. Magnesium plays a crucial role in heart muscle contraction and rhythm regulation. Tingling, numbness, or nerve pain. Diabetics with low magnesium levels are at higher risk for nerve damage. If you recognize any of these symptoms, it may be time to increase your magnesium intake through diet. Magnesium-rich foods for easy supplementation. The good news is that you can easily correct magnesium deficiency through a well-balanced diet. Here are some magnesium-rich foods you should incorporate regularly. Avocados. One medium avocado provides about 15% of the daily magnesium requirement and is also rich in heart-healthy fats. Pumpkin seeds. Just 1 ounce, 28 grams, of pumpkin seeds provides 40% of the daily magnesium needs. Spinach. 1 cup of cooked spinach contains about 38% of the daily recommended magnesium intake. Dark chocolate. 85% cacao or higher. A 28-gram serving provides 24% of the daily magnesium requirement and is packed with antioxidants beneficial for heart health. Almonds. A 1 ounce, 28-gram serving of almonds provides 27% of the daily magnesium requirement. The best magnesium supplements. Which type is most absorbable? If you find it difficult to get enough magnesium from food, supplements can be a helpful solution. However, not all magnesium supplements are absorbed equally well by the body. Magnesium glycinate, the most absorbable form, with minimal digestive side effects. Magnesium citrate, well absorbed but may cause mild laxative effects. Magnesium oxide, poorly absorbed and mainly used as a laxative rather than a magnesium supplement. Recommended products from reputable brands. Thorne magnesium biglycinate, 200 mg per capsule, supports sleep, nervous system function, and muscle health. Doctor's Best high absorption magnesium, 200 mg per capsule, helps boost energy and blood sugar control. Factors that deplete magnesium: avoid these now. In addition to increasing magnesium intake, you should also be mindful of habits that can deplete this essential mineral. Excessive refined sugar consumption. Sugar causes magnesium loss through urine. High caffeine intake, coffee, tea, and energy drinks can reduce magnesium absorption. Frequent alcohol consumption. Alcohol induces inflammation and reduces magnesium levels in the body. Overconsumption of calcium. Calcium competes with magnesium for absorption, so excessive calcium supplementation should be avoided. Magnesium is a key mineral for blood sugar control, improving insulin sensitivity, and preventing complications. If you often experience fatigue, cramps, anxiety, or unstable blood sugar levels, do not ignore the signs of magnesium deficiency. Start supplementing with magnesium-rich foods or high-quality supplements today. Have you experienced any of these symptoms? Comment below and share this article with those who need to know. 2. Zinc. The secret weapon against high blood sugar. If you have diabetes, there's a concerning fact you should know. Zinc loss occurs much faster in diabetic patients than in those without the condition. Studies from the Journal of Nutrition and Metabolism show that individuals with type 2 diabetes have significantly lower serum zinc levels compared to non-diabetics. This is not a coincidence. When blood sugar levels rise, the kidneys work harder to eliminate excess glucose, and along with it, they also flush out zinc, a mineral crucial for insulin production, inflammation control, and cellular protection against oxidative stress. Zinc deficiency not only makes blood sugar control more challenging but also leads to various complications, such as slow wound healing, weakened immunity, and an increased risk of diabetic complications. But how exactly does zinc help people with diabetes manage their condition more effectively? How zinc helps stabilize blood sugar. The body needs zinc to produce insulin, the essential hormone that enables glucose to enter cells instead of accumulating in the bloodstream. A study published in Biological Trace Element Research found that zinc supplementation improves insulin sensitivity and lowers fasting blood sugar in diabetic patients. Beyond that, zinc also plays a protective role by safeguarding the pancreatic beta cells, the cells responsible for insulin production, from oxidative stress and chronic inflammation. Zinc deficiency is also linked to increased insulin resistance, a major factor in diabetes progression. When the body lacks zinc, insulin struggles to bind to its receptors, reducing its efficiency in glucose uptake. As a result, blood sugar levels rise, leading to further zinc loss, creating a dangerous cycle. Signs that you may be deficient in zinc. Zinc deficiency is often overlooked because its symptoms can be subtle. However, if you experience any of the following signs, you may need to increase your zinc intake. Slow wound healing, frequent cravings for sugar and carbohydrates, dry skin, irritation, or white spots on the nails, excessive hair loss, loss of taste, or reduced sense of smell, low libido or hormonal imbalances. These symptoms may not seem alarming at first, but prolonged zinc deficiency can silently damage your body. Natural food sources of zinc. The best way to ensure adequate zinc intake is through your diet. Here are some of the best food sources. Oysters, the richest source of zinc, with just 3 medium oysters providing over 200% of the daily recommended intake. Beef liver contains about 80% of the daily requirement per 100 grams. Along with highly absorbable heme iron, grass-fed beef provides 40% of the daily zinc requirement per 100 grams. Plus high-quality protein for muscle health. Pumpkin seeds deliver 50% of the daily zinc intake per 28 grams and support prostate health. Chickpeas offer 25% of the daily zinc needs per cooked cup, making them a great option for vegetarians. A zinc-rich diet not only helps regulate blood sugar but also strengthens the immune system, enhances reproductive health, and slows down aging. Which zinc supplements are the best? If dietary intake isn't sufficient, supplements can be an effective alternative. However, not all forms of zinc are absorbed equally. Zinc picolinate, the most bioavailable form, shown to effectively increase serum zinc levels. Zinc biglycinate, another well-absorbed form that is gentle on the stomach. Recommended products from reputable brands. Thorn zinc picolinate, 30 mg per capsule, supports immunity and improves insulin sensitivity. Now Foods zinc glycinate, 30 mg per capsule, offers superior absorption compared to standard zinc supplements. A daily dosage of 15 to 30 mg of zinc is safe and beneficial for diabetics. However, excessive zinc intake can disrupt copper balance, another essential mineral. Common habits that deplete zinc levels. Besides supplementing zinc, it's crucial to avoid factors that accelerate zinc loss. High sugar and refined carbohydrate intake increases insulin demand, causing more zinc to be lost through urine. Excessive calcium consumption. Too much calcium from dairy or supplements can inhibit zinc absorption in the intestines. Alcohol consumption reduces zinc absorption and increases its excretion, leading to mineral imbalances. Processed foods high in phytates, found in grains and legumes. Phytates bind to zinc and reduce its bioavailability unless properly prepared, soaking or fermenting. Why zinc is a secret weapon for diabetics. Many people underestimate the role of zinc in diabetes management, but research has shown that this mineral improves insulin sensitivity, reduces inflammation, protects nerves, and boosts immunity. If you're struggling to maintain stable blood sugar, feeling fatigued, or noticing signs of zinc deficiency, consider adjusting your diet today. Have you ever tried supplementing with zinc? Share your experience and join the discussion on natural ways to improve health. 3. Chromium, the overlooked but vital mineral for diabetics. Do you ever feel like your blood sugar is stable one moment, then suddenly spikes for no apparent reason? Or do you constantly crave sweets even after eating a full meal? If this sounds familiar, your body might be lacking an essential yet often ignored mineral, chromium. Many diabetics struggle with blood sugar control despite their best efforts. They monitor their carb intake, take medications as prescribed, exercise regularly, yet still fail to achieve consistent glucose levels. One major reason is a chromium deficiency, a mineral that enhances insulin efficiency and improves how the body processes glucose. Chromium not only affects blood sugar regulation but also influences cravings, energy levels, and even mood. If you often feel fatigued, experience frequent hunger, or struggle with weight management, it may be time to pay closer attention to your chromium intake. How chromium affects insulin and blood sugar. The body relies on insulin to transport glucose from the bloodstream into cells, where it is used for energy. However, without sufficient chromium, insulin becomes less effective, leading to elevated blood sugar levels and insulin resistance. Research from Diabetes Care found that chromium supplementation significantly lowers fasting blood sugar and improves insulin sensitivity in individuals with type 2 diabetes. Another study from the American Journal of Clinical Nutrition discovered that people with adequate chromium intake have a much lower risk of developing diabetes compared to those deficient in the mineral. Chromium enhances insulin function by improving its binding ability to cell receptors. This allows glucose to enter cells more efficiently, stabilizing blood sugar levels and reducing stress on the pancreas. Signs that you may be deficient in chromium. Chromium deficiency can impact multiple aspects of daily life, but most people don't recognize it. If you experience any of these symptoms, your body may need more chromium. Blood sugar fluctuations despite dietary control. Intense cravings for sugar and refined carbs, especially after meals. Persistent fatigue and sluggishness even with sufficient sleep. Brain fog, difficulty concentrating, and memory issues. Mood swings, irritability, or anxiety. Unstable blood sugar not only makes you feel drained but also increases the risk of severe complications like cardiovascular disease, nerve damage, and vision impairment. Best food sources of chromium. Since the body cannot produce chromium, it must be obtained through diet or supplements. The best natural sources include broccoli. Half a cup provides 50% of the daily chromium requirement. Lean beef. A 100-gram serving contains about 25% of the necessary intake. Eggs. Each large egg supplies 10 to 15% of the daily chromium needs. Brazil nuts. A single nut provides around 30% of the required amount. Grape juice. 1 cup contains 40% of daily chromium needs, though diabetics should consume it in moderation due to its high sugar content. Incorporating these foods into your daily meals can naturally enhance insulin sensitivity and blood sugar stability. Best chromium supplements. Which type works best? If you struggle to get enough chromium from food, supplements can be a useful alternative. However, some forms are absorbed better than others. Studies show that chromium picolinate and chromium polynicotinate are the most bioavailable and effective at improving insulin sensitivity. Recommended products. Now Foods Chromium Picolinate, 200 mcg per capsule, supports blood sugar control without side effects. Thorne Research Chromium Picolinate, 500 mcg per capsule, ideal for those with severe deficiencies. A safe and effective dosage ranges from 200 to 500 mcg per day. Depending on individual needs, chromium, along with magnesium and zinc, may be the missing piece in your diabetes management plan. Will you take the challenge? Start incorporating chromium-rich foods into your diet today and observe the changes in your energy levels and blood sugar stability.